Hello, my name is May Kwong. I'm the Executive Director at the Center for Connected Health Policy, the federally designated National Telehealth Policy Resource Center. Today I'll be talking about the current status of federal and California telehealth policy during COVID as of December 1st, 2020. A few disclaimers before we get started today. Know that any information I provide in today's talk is not to be regarded as legal advice. It is strictly for informational purposes. CCHP always recommends that you consult with legal counsel if you are interested in a formal legal opinion. And know that neither I nor CCHP has any financial interest, arrangement, affiliation, or relationship if I happen to mention a company or show some type of product. CCHP was established in 2009 as a program underneath the Public Health Institute. We became the federally designated National Telehealth Policy Resource Center through a grant from HRSA in 2012, and we've been serving in that capacity ever since. We also work with a variety of funders and partners on other telehealth projects. One thing that we do under our federal grant is the state telehealth Medicaid policies, laws, and regulations for all 50 states and the District of Columbia. So as most of you might be aware that before COVID-19 hit, telehealth policy, both on the federal and the state level, really was very diverse. This is an example of what was going on the federal level, where telehealth policy on the federal level, Medicare is really where you saw a lot of established policies, and it was fairly limited. It was restricted by where it could take place, what types of services were covered, the types of providers who could provide those services and get covered. But there were also other policies that limited the use of telehealth, such as like how it could be used to prescribe a controlled substance. When COVID-19 hit, there was widespread telehealth policy changes, at least on a temporary basis, both on the federal and state level. This is an overall 100,000-foot snapshot level of the different policy changes that took place and the specific issues that they covered. As you can see, both on the federal and the state level, there's a lot of commonalities as far as issue area that was touched upon, and that's mainly because a lot of the established telehealth policies before COVID-19 that were telehealth specific related to coverage of telehealth services and the reimbursement for them. And those reimbursement policies are usually divided up into like 4 common elements, some of which you see reflected on this slide. But also if you look underneath the tables, there are other areas in which telehealth policy was also impacted by the changes in COVID. Again, this is a very quick snapshot of the timeline of some of the federal policy changes that took place at the beginning months of COVID. And as you can see, they were pretty close together and they were pretty rapid over those first 6 to 8 weeks. There were a combination of administrative and congressional changes. So bills that were passed by Congress, but also moves that CMS made in order to change the Medicare policies. It did quiet down a little bit over the summer, but then we saw towards the end of this year a little bit of pickup again of some of the policy changes and some things being made permanent, both on the federal and the state level. This has been the impact of some of those policy changes, at least on Medicare, which is not surprising. Again, in the early weeks, we saw that there was an increase in the utilization of telehealth, very significant when compared to the previous year. And then it kind of levels off and dips because as places began to open up more and people went out and were feeling more comfortable going to their healthcare professionals, we saw less telehealth visits, but then we start seeing a slight uptick again as the pandemic progressed a little bit further than we had hoped it would. I mentioned earlier that there are a lot of commonalities on federal and state telehealth policies, and because a lot of those policies cover reimbursement and coverage of services, and that there were certain common elements on how those policies are structured. For a reimbursement policy, you really have 4 basic elements that a lot of them cover. So they impact where the patient's located, what service is being covered, how that service is being delivered or the modality used, and what provider is providing that service. When you're talking about federal policy, reimbursement policy, and Medicare, really the one place where CMS has administrative control in which they can change the policy without waiting for Congress is what service is covered. All the other elements, the location, the provider modality, those are embedded in federal law. So you have to wait for an act of Congress to change that. And that's added a bit of complication here during COVID-19. A lot of questions remain as to what will become permanent policies once the pandemic is over. So that's a little bit difficult to answer right now, because what a lot of those changes would need would be Congress to make that a permanent change happen. And so far right now, we're just really left with temporary changes in response to the specific pandemic. However, again, the one area where Medicare does not need to wait for Congress is to decide what services that they will allow to be covered underneath the Medicare program if telehealth is used to provide those services. And that's exactly what they did. So every year, CMS comes out with a physician fee schedule, which is their proposals on how they would do reimbursement or what they'll be covering in the Medicare program for the following year. It comes out sometime in the summer, usually around July or early August. There's a require a congressional change. Other things that they did do was around communication-based technology. So that is another area of CMS reimbursement that is not considered telehealth by CMS, but it uses telehealth technologies to provide those services. Those are your remote patient monitoring types of service, your virtual check-in codes. They did do some work on there. And what they also did was change some of the supervision requirements or frequency of visit requirements. So they are now allowing skilled nursing facilities to receive telehealth visits at least once every 15 days, I believe is the number there. Whereas before, without the temporary relaxation, it was once every 30 days. Another thing that they did make permanent was some of the home health changes. This was outside of the physician fee schedule. It was in a different regulatory process that they did. So some of those home health changes have been made permanent as well. So there are lots of pieces of proposed federal legislation out there trying to make some of these temporary changes permanent. These are just a couple examples. I just pulled out a few bills. This is one of the ones that would make some of the larger changes permanent. The other ones were very specific to specific issues or areas. But it's actually, my belief that probably none of these bills will get passed. What has tended to happen historically, at least within the last couple of years, is that elements from telehealth bills have been placed into larger bills, such as a budget act, and that policy has gotten through that way or been approved that way. So I think we'll probably see that happening, especially now on the day that I'm recording this, which is actually December 14th. Right now, Congress is discussing the budget act for the following year, as well as a potential another COVID bill. I think if we're going to see some sort of permanent telehealth policy change go through Congress, it's probably going to be in one of those larger pieces of legislation just embedded in there somewhere. What's going on at the state level? So between July and August, we took a look at that because we picked that period as a lot of states were winding up their legislative process there. So 31 states made permanent changes, but we're not quite sure if they were directly as a result of COVID. Some of these changes may have been in the works before COVID hit that the states were thinking about. Obviously, if it mentioned the pandemic or COVID, it was obviously related to that, but not all of them did. And also there were a lot of changes that were made through the administrative channels in their Medicaid program rather than through legislation. Here are some of the Medicaid policy changes that were adopted Phone, if phone was going to be something that they were going to continue doing as a permanent change in their Medicaid policies, it was for something specific. So it wasn't a wide sale or wholesale sort of like coverage allowing telephone to be used for anything. It was for very specific services. And clarifying such policies such as like if services can take place in the home or if an FQHC and RHC can act as a distance site provider or some of the policies that impact them. Here are a few more details here. What's interesting is Alabama and Alaska clarified that they would not allow audio-only phone in their Medicaid program. So you also had the opposite happen of like increasing policy to allow audio-only phone and also being very explicit about saying, no, we are not doing that. Legislation, this is a comparison of 2019 and 2020 legislation. If you look at some of what they were doing, the topics changed slightly as far as the types of bills that were being passed in 2019 to what was being passed in 2020. Obviously, we were dealing with two different major environments here, so that may have had an impact on there. But 104 legislative bills were passed in 36 states. Sort of the top issues or the most popular issues for those bills were modifications, not necessarily a new private payer law being passed, but modifications to private payer laws being passed, Medicaid reimbursement and regulatory and licensing. 35 of the bills of the 104 were directly in response or explicitly mentioned COVID. So again, we're in that situation of we weren't sure if like all these bills were in response to the pandemic or, you know, could they have been something that was being considered by the state beforehand. Some of the bills that were being passed here, Medicaid, some of the popular ones that were being passed, but this is the one that's interesting. This is on studies and data. So in the past, if these types of bills, pilot bills were being passed on the state level, they were for, you know, very specific pilots, such as we will study the use of provision of telemental health in a school setting and, you know, run that pilot for 5 years and see how that goes, and we'll have a report sent to the legislature. These pieces of legislation that were passed were bills that said that they wanted to collect information on the use of telehealth during the pandemic or to collect specific data on like the efficacy of using telehealth. So it was a very specific conscious attempt to gather that data, which for a lot of times people have said that didn't really exist in a comprehensive fashion for telehealth. So there were some states that deliberately passed legislation to specifically look at this issue. And I think we might be seeing more of those as we go into 2021, cropping up in different states, this concerted effort to really get down into the data and collect it. What do we have to look forward to? On the federal level, there is a new administration. I have been hearing things that there may be some interest in telehealth from the new administration. The current administration, the Trump administration, has over the years shown a lot of interest in telehealth. I don't know the extent of the Biden administration of what they may be interested in, but I am hearing signs that they are interested in it. I do think it's likely the public health emergency will be extended at least one more time, if not more. So it's set to expire on January 21st, 2021. I think at least they'll be extended at least another 90 days, again, if not more. And right now, as of December 14th, we have Congress trying to pass a budget and possibly another COVID bill. And as I said earlier, I think if there's going to be a permanent telehealth policy change, it might be embedded in one of those vehicles. On the state, what we have going on there, a few months ago, there was not a clear picture, I think, for some states on what their budgets going into 2021 was going to look like. So that may have made them a little hesitant on doing a permanent telehealth change because they weren't quite sure what the fiscal situation would be for the state. So it's a little bit clearer, I think, for them now. So they may be more willing to make a permanent decision on a temporary telehealth policy. I think also that they may delay that too, because a lot of the state changes, a lot of them had it tied to the federal public health emergency. So as long as that is extended, they may feel like we've got a little bit more time to look at this a little bit longer because we have said that this won't expire until the federal public health emergency is declared over. But I think it's clear, given that there was some state action in 2020 to make things permanent, that some of the states are just moving forward with like looking at this and deciding and making a decision on what to make permanent. And I think that'll continue into 2021. Here are a couple of links to our CCHP website, and also know that you can sign up for our CCHP newsletter. We do try to keep people as informed of like any late breaking news. Definitely did that during the beginning weeks of COVID, so we may have overwhelmed a lot of our subscribers. I think people found that useful as well. So I just want to wish everybody a happy holidays and a happy new year, and we'll see everyone in 2021. Thank you.